let's continue with the conversation. So you have this in the ICU. The patient has no symptoms. So you have a more than 5 second pause, more than 5 seconds. What would you do for this patient? There's no reversible causes. We talked about putting a pacemaker, which is the right thing to do. If you have a patient in AFib, this is from the guidelines. If you have a patient with third degree and advanced second degree AV block at any anatomical level, we're going to skip that part, that is awake, symptoms free, with AFib and bradycardia, the indication for pacemaker is that the pause has to be at least 5 seconds or longer. So basically, a pacemaker is indicated in patients with AFib and 5 second pauses or greater. Symptoms free, right?
Did you look at the ICU for this 3-second pause, 3.5
No.
pause, or just because of everything that added into it?
Oh, just because I was asking for tele nurses and there were no more, so there were ICU nurses and we just invented a patient.
Oh, so you,
Yeah.
so you just moved in.
Yeah, but so if you have a patient with asymptomatic, you have a patient with no symptoms that is in AFib and has pauses less than 5 seconds, there is no indication for pacemaker. So the patient could be discharged home. If the pause is more than 5 seconds, he needs a pacemaker.
So how often would you see a patient that has this pause and then nothing else afterwards? Is that normal?
Yeah.
Or would that,
Yeah, sorry.
A long 3-second pause can be
Sleeping.
more on the normal side than on the other.
Yeah, for example, sleeping. That's why I put 2 in the morning. But Matt made up a patient that was watching TV. I think I did it. Anyway, that was watching TV. So, yeah, a patient that is sleeping will have, especially if they have sleep apnea, they will have arrhythmias, either tachy or brady. And that,
programming at 2 a.m.
the what?
It could be the program.
It could, I don't know what he's watching at 2 in the morning. You guys are good. Sam has weird channels. So, yes. So basically, the reason why we have 5 seconds as an indication for pacemaker, 5 seconds or more, is because the AV node should kick in after 5 seconds, like you were saying. So if the AV node is not kicking in, maybe there's AV block, and we just don't see it. Maybe there's paroxysmal AV block. You don't see it because you don't have P waves. You have AFib. So that's why the guidelines are there to recommend that you put a pacemaker on a patient like that.
What happens if you have a lot of 3.5 second pauses, like it becomes more frequent?
As long as they're asymptomatic, they're asymptomatic.
So,
Yeah.
in this situation where it's indicated for pacemaker, how urgent or how, like, are we on the phone making that call or transcutaneous or anything like that? Or
No.
transvenous?
If you have a patient,
As long as they're
well, two
asymptomatic.
things, right? If the patient is really asymptomatic and he's there for cellulitis, you will not be putting a pacemaker until the infection cleared. But let's say the patient is there because I don't know, whatever.
Dizziness or,
Yeah, no, that would be symptomatic. So let's say it was there for something else. Then you would put a pacemaker when the next day or the following day. You want to make sure that medications really are not an issue. You want to make sure there's TSH is normal. You want to make sure other things are normal. There's not, the risk of death from this is very low. The risk of, because obviously you don't want the patient to go home, but you could wait until next morning. It's not an emergency. So yeah, so that's how we finished last talk, and